specialize in neuro-ophthalmology. So this is my life, and I love sports. So I try to put together ophthalmology, the eyes, and the sport. I'm a doctor, I'm an eye doctor, so for me, science is the best option. That means that science must always be the first thing when we speak about neurostimulation and NeuroTracker. The first thing is to be sure that everything is good with the eyes. This is quite normal. After that, we just check about the visual pathway. Most of them, they have excellent vision. So it's not about really the vision, it's how you treat the information you receive. The athlete will train his body, will run, will do exercise, will do maybe exercise with the puck, with the ball, it depends on the sport, but nothing for the brain. And the brain, if you take the brain as the treatment of all the information, and this is the role of the brain, you must be as good as you can with your brain. What effect does the neurostimulation? And they were all, I can say all, with the same answer. We are better. All the goalkeepers, the hockey goalkeepers, just said that they were put in slow motion. That means they have more time to react, to see the puck, or in French, le palais, and that was just amazing for us. And we open wide the visual field with NeuroTracker. If you take a Formula One driver, when he said to us that he has more time to react, more time to see the curves, more time to react about the cars around him or around his car. That's just amazing. Slow motion is just, you are like a fluid. You are just maybe more relaxed. You have more time. You can do it better. The hockey goalkeeper, if they have more time to catch the puck, that's perfect. You must train and train and train. And this is competitive because the athlete will be better from one time to the other time, to the other time, to the other time. You will have a curve. That means that you will increase your result, and at one level, you are just at your higher potential. And this is very important because if one day, it depends on the sport, but if one day you have a health problem or a concussion or something like that, your level will decrease. And if we know your higher level, we can bring you again to the higher level. And this is very important. With all the new patients or the new athlete coming to Neurovision consulting, each one will have the baseline. That's the first thing. But we have many without a baseline before. So we start from the point where they are, and the first score are just not so well. I won't say nightmare, but it's the reality. They are unable to focus, to have attention, to be a part of what we can bring to them. But after the second session, the third one, the fourth one, everything is better. Now we work on very short protocols, and these protocols are just terrific. We had rugby player. We were able with our protocols. It's short times protocol. That means in 3 days we were able to bring them back to play stronger, better, and with 100% of capacity. We had players. It's not one players. It's players with no eyes since 5 or 6 months. No eyes playing. That means that concussion, second one or third one, no return to play. And that means they They came to us, and after 5 weeks, they were able to train again and to return to play. And this is just amazing. For us, it was a big surprise. Concussion, treatment of concussion, with the result we can have, it was just a big surprise. We use only visual strategy. Once again, no pills, no injection, no treatment. It's just a visual strategy. And from the visual strategy, you wake up your brain. You just ask your brain to be back on the track, and if the brain can manage the session, you will be better and better and better. When we speak about neurostimulation, about NeuroTracker, it's just a revolution. It will be a revolution because we will change the way sports is done, about how you help the athletes.